Hello, I'm Brandon Scharer. I'm a foot and ankle surgeon at Bay Care Clinic. A common misconception for people is that they think it's a growth of bone, when a matter of fact it's actually a malalignment of the joint. The big toe will get a prominence on the outside of the joint, which is actually the first metatarsal shifting medially or inward, and then the toe shifts the other way and creates this bump-looking appearance. Patients typically show up to the office with bunion pain because they hurt. Typically the pain is exacerbated by tight shoes. Another misconception is that tight shoes cause bunions, and that is not true. The most common cause of a bunion deformity is actually genetics, hereditary. Usually they get them from their parents. Bunion treatment is very simple. It's lumped into basically two categories: conservative, which is non-surgical, and non-conservative, which is surgical. The conservative treatment for a bunion is very simple: wearing appropriate shoes. The wider the shoe, the padding around the bunion in order to alleviate the symptoms, that's essentially it. Sometimes we can do a custom orthotic, which is an inlay that you can put in the shoe to offload the area, but typically it's just wearing a wide enough shoe with a wide enough toe box in the shoe to accommodate for the deformity. Bunion surgery varies significantly based on the severity of the bunion. Typically, it involves a cut in the bone which has to be shifted to realign the joint. And for the most part, patients are able to walk on that surgery site the day of surgery. In some cases where the bunion is more severe, we have to go and fuse part of the joint, which eliminates the patient from walking for about 6 weeks. But the most common bunion procedure is a simple cut in the bone. We put screws across the cut in the bone and they can walk on it immediately. A big misconception is that bunion surgery is going to lay me up for many months and I cannot put weight on my foot. That is not true. Typically patients can walk out of the operating room the same day on the bunion if it's a mild to moderate bunion. The other misconception is that patients think the procedure is very painful. The procedure typically isn't any more painful than your standard knee arthroscopy, shoulder arthroscopy, or any other type of orthopedic procedure.